Hi, my name is Taylor Torres, and today we're going to go ahead and do a few body composition assessments with our client here, Kim. The first thing I'm going to go ahead and do is take her resting heart rate. So the first thing is I'm going to find her radial artery, and then I'm going to go ahead and take her resting heart rate for 30 seconds, multiply that by 2, and that's going to give us her heart rate for 1 full minute. Okay. So what I just recorded was 34 beats per second. And so when I multiply that 2, I'm going to go ahead and get 68 beats per minute. So the next thing we're going to go ahead and do is take her blood pressure. So I will go ahead and grab our blood pressure cuff. I'm going to put this around her left arm, right above her brachial artery. And the next thing I'm going to go ahead and do is find her brachial artery. And then I'm going to go ahead and place the head of my stethoscope over that brachial artery. And then I'm going to go ahead and pump it up to 180 millimeters of mercury per. And then I'm going to go ahead and decrease at 2 millimeters of mercury per second. Okay. So what I recorded here was 118 over 68. Alright, so we're continuing with our body composition assessment, and the next thing we're going to go ahead and do is take our client's skin fold test. So the 3 sites for a female that we're going to do with our client Kim here is her tricep, her suprailiac, and her thigh skin fold test. So the first one we're going to do is her tricep. So I'm going to have her go ahead and stand sideways. The first thing I'm going to do is measure from her acromion to her olecranon process and find the difference between the two, and that's where I'm going to mark. So it's about 11 and a half inches. So I'm going to mark in between that, which is 5 and a half. And so that is here. The next thing I'm going to do is I'm going to have my client go ahead and flex her tricep muscle, and I'm going to pinch at that site. And so this method, you can go ahead and relax. This method is going to allow me to determine if I'm pinching only her skin, her muscle, or her bone. So what I just pinched right there was strictly her skin because she was flexing her muscle, so that's exactly what I want when I am using our calipers. So I'm going to go ahead and have our client here relax again, relax, and then I'm going to go ahead and pinch her skin at this measurement that we determined, and then I'm going to measure it with our calipers. And so what I measured here is 31 millimeters. So I will document that. The next site that we're gonna go ahead and do is the suprailiac. And so for this, I'm gonna go ahead and have our client show me where her hip bone is. Okay, I'm gonna go ahead and verify that here. And then the next thing I'm gonna go ahead and do is I'm gonna move up diagonally toward along the natural line of her iliac crest. That's where I'm gonna, in this groove here, that's exactly where I'm gonna go ahead and pinch. So I'm gonna go ahead and mark that. So her hip bone is here, and just above, I'm gonna pinch here. So I'm gonna go ahead and mark this. That's the site of where I'm going to measure. So hip bone, this groove here, the natural lining, I'm gonna go ahead and move to this side. See, here, okay. I'm gonna go ahead and pinch this side and then measure here. So what we have is 21 millimeters for that site. I'm gonna go ahead and document that. And then the last site that we have is the thigh. So I will have our client go ahead and hold the tape measure to the crease of her hip, or excuse me, the crease of her leg. And then I'm gonna go ahead and measure the distance between the crease of her hip and her patella. And that's at about 16 inches. So I'm gonna go ahead and mark at 8 inches, which is the difference. Okay, thanks. So that's where I will be measuring for that site. I'm gonna go ahead and use my skin calipers to measure this site. I'm gonna have our client put all of her weight on her left leg to have this leg relaxed. I'm gonna pinch the site. And then measure here. So we have 45 millimeters for that site. I'm gonna document that. And then our last assessment for body composition will be our girth measurement. Last test will be the girth measurement. I'm gonna be measuring our client's waist and her hip. So the first one that we're gonna do is her waist. I will place the measuring tape around her waist. And then go ahead and have our client lift up her shirt. So we place the tape right above her belly button at the smallest portion of her body, of her torso, which is going to be her waist. I'm going to bring the tape measure as close as possible without squeezing her torso together and making sure that the tape measure is not too loose. And so the measurement that we have here is 87 centimeters. So I will document that. And the last site is her hip measurement. So for her hips, we're gonna have her turn sideways. I'm gonna go ahead and mark her hip at her hip as well as her butt area as well. I'm gonna go around both of those areas. Can you lift your shirt? Thank you. And so what we have here is 111.5 centimeters. So I'm going to go ahead and document that. So those were all of the assessments for body composition. Hi, so we're continuing with all of our assessments. So the next assessment that we're going to go ahead and do is our muscular endurance assessment. So the first test we will be doing is our push-up ACSM push-up test. So for this test, all you need is your client, and if you would like, it's optional, you can have a mat. Today we're not going to be using a mat. So I have our client here. There's two types of push-ups that you can do with your client depending on their strength, their upper body strength. They can do a standard push-up or a modified knee push-up. After discussing with our client, we discussed that she will be doing a modified knee push-up. So for that modified knee push-up, your client is going to start on her knees. She's going to start on her knees, and then she will have her arms out in front of her, a little bit wider than shoulder width apart. She's going to have her hands directly underneath her shoulders. Her ankles will be flexed, and her body will be level. So this is going to be her starting position. From that position, she's going to go ahead and go down into that push-up, making sure that her chin is up, her body stays level and flat, and she goes down with her chest, and her stomach stays level, her back stays level as well. From that position, she's going to go ahead and push back up and extend from her arms, and a level back and a level stomach, and extend all the way back up into starting position. That's going to be her first repetition. She's going to continuously do as many as she can until she gets tired, and then if our client is unable to do consecutive push-ups, that's when we will stop the test, excuse me. So there are a few common faults that we do need to discuss. So a few common faults that do happen is that our client will sometimes have their hips sagging, and so that'll look like this. When they're doing their push-up, their hips will be sagging here instead of being level and flat. Also, sometimes our client will have their arms spread apart way too far, or their arms will be extended out in front of them away from their body. Also, we want to make sure, another common fault is that sometimes the hips will be lifted and raised as well. We want to make sure that their back is level and flat all the way through when they're going down to their push-up and coming back up. So a demonstration of what this is going to look like. As I said, you're going to go down onto your knees. You're going to have your shoulders a little bit wider than shoulder distance apart. You're going to have your hands underneath your shoulders, your chin up, your ankles flexed, and then you're going to go down to your chin to the ground and come back up. So it'll look like this. Okay. So that's what's going to be happening. Like I said, just remember you're going to do as many as you can at a consecutive pace and consistently. And then when you feel like you're tired and you're done, we will stop the test. Do you have any questions? No. Okay. So go ahead and get down into that push-up position. Okay, we're gonna go ahead and stop. So that was our trial run. So a few things that I did notice is that our client was lifting her feet off of the ground when she was doing her push-ups. So you wanna make sure that your toes are staying on the ground and they're not lifting up, and then we're all the way level with our body and we're not arched up. Okay, so this is where our test is gonna go ahead and begin. Ready?
Yes.
Okay, go ahead. One, good. Two, three, good job. Okay. So our client did 3 push-ups, so I will go ahead and document that. And then the next test that we will be doing is our curl-up test. that we will be doing is our ACSM curl up test. So for this test, all you need is your client. You need 2 pieces of masking tape or any type of tape, and optional, you can use a mat. So for this test, we will not be using a mat. We're just going to be on the floor. We have our client here, and we also have our 2 pieces of tape. So for this test, you're going to have your client lie down in a supine position. You're going to have his or her hands on the ground, fingertips on the ground as well by their side. Their knees are going to be up at a 90-degree angle, and that's going to be their starting position. So from that starting position, our client is going to have their spine flexed at least 30 degrees, and they're going to go ahead and slide their fingers on the ground to that second piece of tape. From there, they're going to go back to a starting position, and that's going to be 1 repetition for their curl up. So it'll look something like this. Our client will be, as I said, supine on the ground, legs bent 90 degrees, hands by their side. Their fingertips should be touching the front of the line. And so in order to do the curl up, they're going to hear a metronome. A metronome is just a series of beats, and it's going to be at 40 beats per minute. And so when they hear that first metronome, that's going to signify for them to go ahead and go into their curl up. They're going to curl up to that second piece of tape and then curl back down. So curl up, touch the tape, and then come back down. Curl up, touch the tape, and then come back down. So they're going to continuously do that movement for as long as they can. And a few things just to remember when you are setting up this test is that the 2 pieces of tape should be 8 centimeters apart depending on their age. So because our client is over 45, they should be 8 centimeters apart. If they're under 45, it should be 12 centimeters apart. Also, we want to make sure that our client starts with the fingertips on the first line, and then they're sliding to that second line. A few common faults that do happen and that will stop the test is if one hand does not reach that second line, if our client's legs extend out, or if both hands do not touch that second line. That's going to cause the test to stop, and then we would just calculate however many you've done at that point. So what's going to happen now is I'm going to go ahead and demonstrate for you again what that's going to look like, and then I'll have you do a practice test, and then we'll do the actual test. Okay? So one more time, a demonstration. Fingertips on this line. Once you hear the metronome, you're going to go ahead and slide forward and then back. Slide forward and then back. Okay? Do you have any questions? No. Okay. So we're going to go ahead and have you lie down on your back. Okay, and then you're going to scoot up. A lot more. Okay, and then when you hear the metronome or the beeps, that's the rhythm that you're going to go to. So all we're going to do is we're just going to do one, and then I'll give you a little feedback, and then we'll go straight into the test. Okay, ready? Okay, so just a few things. When you are doing the curl up, you want to make sure that you are lifting as much as you can. Try and lift your shoulder blades off of the ground so that you can reach that second piece of tape. Okay? And then you're going to go with the rhythm of the metronome. Okay? Okay, we're going to go ahead and stop the test. You can go ahead and stand up for me. Okay, so after those 2 attempts that our client did, I noticed that she was unable to reach that second piece of tape either of those times. So we're just gonna go ahead and stop the test from there, and then we'll try and determine other exercises or other assessments that we can go ahead and do for her so that we can get a baseline of her muscular endurance for her core. So we are continuing taking our client's heart rate post muscular endurance assessment. So I'm going to go ahead and take her heart rate. Okay, so I found her radial pulse. I'm going to go ahead and measure that for 30 seconds. I'm going to multiply that by 2, and it's going to give her her beats per minute. You can go ahead and relax it. So what I just recorded was 40 beats per second. So I'm going to multiply that by 2, and I get 80 beats per minute. So the next thing we're going to go ahead and do is take her blood pressure. So I'm going to move over to her left side. I will be placing the blood pressure cuff around her left arm, right above her brachial artery. I'm going to go ahead and find her brachial artery. Okay. I'm going to place the head of my stethoscope over her brachial artery. And then I'm going to go ahead and pump up the cuff to 180 millimeters of mercury. And then I'm going to release at 2 millimeters of mercury per second. Okay. So what I heard there was 120 over 62. Hi, today we're continuing with our flexibility assessment. Today we'll be doing 2 tests. The first test that we're going to have our client here, Kim, do is our YMCA sit and reach test. For this test, all you need is a yardstick, a piece of tape, and your client. So for this assessment, I will have my client go ahead and have a seat on the floor. When she's on the floor, she's going to have her heels touching this piece of tape across the yardstick that's at 15 inches. From there, she's going to place her fingertips on top of each other. She's going to go ahead and stretch forward and reach as far as she can up across the yardstick. Hold for 3 seconds so that I can record that measurement and go back to the starting position. So I'm going to go ahead and demonstrate that for her. So I'm going to have my feet at the tape line, which is 15 inches away. My hands together on the yardstick. I'm going to inhale, exhale, go ahead and stretch forward as far as I can. Hold for 3 seconds, and go ahead and come back up to starting position. Okay, so that's going to be your test. You're going to go ahead and have 2 attempts. We're going to take the highest number for that attempt. Okay, go ahead and have a seat. Scoot back a little bit more. Good. Okay. And go ahead when you're ready. Inhale and then exhale. exhale, stretch forward. Okay, and release. Okay, so that one I recorded was 15 inches. So I do want to remind our client, we want to try and make sure that our knees are not lifting up. We want to keep our legs extended as much as possible. If they do lift forward, that's going to cause us to not get as much of an accurate assessment for this test. So we're going to go ahead and try it again, and this is going to be our last attempt. Okay, go ahead. Okay, and so that one was a little bit more. It was almost 15 and a half. So I'm gonna go ahead and document that. So our next test that we will be doing are goniometry measurements for our client.
Go.
So we're continuing with our goniometry test. So the sites that we're going to be doing with our client are her shoulder, her elbow, her hip, and her knee. And we're all going to be measuring the right side for her range of motion. So for the first test, we will be measuring her range of motion in her shoulder. What I'll have our client do is she's going to go ahead and lift her arm and raise it as high as she can in a sagittal plane of motion over her head, and she's going to hold it at that point. What I'll be doing with the goniometer is I'm going to place the axis of the goniometer on her acromion process, the distal part of her acromion process. The stationary and the movable arms will be parallel to her trunk. When she lifts her arm, the movable arm is going to be in line with her humerus. Okay, so you can go ahead and put your arm down to your side. You can relax it. Okay. And then I'm going to place the axis of the goniometer on the distal portion of her acromion process. And then you can go ahead and lift your arm as high as you can. Okay. And what I measured here was 135 degrees in her shoulder, for shoulder flexion. So the next site that we are measuring for range of motion is the elbow. So we will have our client exteriorly rotate at the elbow. She's going to have be in a supinated position. I'm going to have the axis of our goniometer at the lateral epicondyle of the humerus. And then I will have our stationary arm at the midline of the humerus and the movable arm at the midline of the radius. So when our client's ready, she's going to go ahead and flex her elbow as far as she can. She's going to hold it at that point until she cannot flex anymore. And at that point, that's when I will move our stationary and our movable arms to measure the distance. Okay, go back to neutral. Okay. Okay, and go ahead and flex as far as you can. Okay, and so what we have here is 140 degrees of elbow flexion. So I will document that. And then the next measurement that we will be taking is at the hip. So we're continuing with our range of motion, our goniometry. So the next site that we will be doing is we will be measuring our client's hip here. So what I'll be doing is I will find our client's pelvis, and then I'm going to palpate that. And then what I'm going to do is when I lift our client's leg up into hip flexion, I'm going to see when her pelvis posteriorly rotates, and that's going to signify to me that that's her limit, and that's where her range of motion stops. So I'm going to place the axis of our goniometer on her greater trochanter. Which is about here. And then I will have the stationary bars on her trunk and or her mid-axillary line. And then I will have the movable bar along her femur and referencing her lateral epicondyle of the femur. So I will go ahead and palpate our client's pelvis. And then I'm going to go ahead and bring our client's leg to flexion. And here's where I feel the client's pelvis posteriorly rotate. So I'm going to have our client hold here. You're not going to pull any further, you're just going to hold from here. I'm going to place our axis of our goniometer, as I said, on the greater trochanter, which is here. I will have the stationary arm of our goniometer on her mid-axillary line, and the movable bar will go up to, or will reference her lateral epicondyle of the femur. And what we have here is about 93 degrees of, you can go ahead and release, 93 degrees of hip flexion. So for our last measurement of range of motion with our client, we will be measuring her knee. So for this measurement, I will go ahead and have our client, when she's ready, she's gonna go ahead and flex her knee, and she will be sliding her foot on the ground to her butt as far as she can. She's gonna hold at the point to where she cannot flex anymore, and that's where I will start my measurement. I'm gonna have the axis of our goniometer on the lateral side of the lateral epicondyle of the femur. I will have our stationary arm on the midline of the femur with reference to the greater trochanter, and our movable bar, or our movable arm will be in the midline of the tibia with reference to the lateral malleolus. Okay, so what I'm going to have our client do, she's going to go ahead and lift her foot onto the ground and slide her foot to her butt as much as she can. Perfect. Okay, so I will go ahead and find her lateral malleolus. I'm going to, not lateral malleolus, lateral epicondyle of the femur. I will go ahead and find that superiorly, and then I'll slide down to find the lateral epicondyle of the femur, which is here. I'm going to place our axis here. The stationary bar will be at the midline of the femur with reference to the greater trochanter, and our movable arm will be in line with our tibia with reference to the lateral malleolus. Okay, and so what I've recorded here is 115 degrees of knee flexion. Okay. So first, I would like to thank our client Kim here for participating in all of our assessments. That was our last assessment for flexibility, and thank you. Have a good day.